Assalamu alaikum. What happens in the complete occlusion of anterior spinal artery? In complete occlusion of anterior spinal artery, there is involvement of these two tracts, this ventral horn, that means anterior horn, and this lateral horn. For ventral horn involvement, there is lower motor neuron type of lesion or lower motor neuron type of deficit, and for lateral horn involvement there is upper motor neuron type of deficit. But in here the dorsal column, this is the dorsal column, it spares. So fine touch, proprioception, 2-point discrimination, these are all spared in complete occlusion of anterior spinal artery, and the whole area is involved. If you see a section like this, the whole area is involved, but the dorsal column is spared. That time you can confirm that this is complete occlusion of anterior spinal artery. And one unique thing you can remember, that sometimes when you are treating or when you are repairing aortic aneurysm, at that time it can happen. At that time there may be complete occlusion of anterior spinal artery. Now, what is tabes dorsalis? We know that tabes dorsalis usually happens in syphilis. Tabes dorsalis usually happens in syphilis. In syphilis, usually in tertiary syphilis. So D is D for dorsalis and D for dorsal column. So in here there is involvement of the dorsal column, but other area, anterior spinal cord and lateral spinal cord, is spared. As dorsal column is involved, so fine touch, proprioception is lost, and in here there is a positive Romberg sign. There is positive Romberg sign. In here there is positive Romberg sign, and there sometimes there is gait ataxia is also present in here. There is ataxia which is sensory. There is ataxia, sensory ataxia is present in here, and there is absent DTR, deep tendon reflex. So you can remember easily by this mnemonic, that dorsalis, dorsal column, and DTR. That means tabes dorsalis and dorsal column is involved, and there is absent DTR. Spinal muscular atrophy, also known as Werding-Hoffmann syndrome. In here in Werding-Hoffmann syndrome there is anterior horn is involved. This anterior horn is involved. As there is involvement of anterior horn, so there is lower motor neuron type of deficit, but dorsal column is spared, so no fine touch, proprioception, 2-point discrimination is present. There is no fine touch, proprioception, and 2-point discrimination is lost. On the other hand, as there is involvement of anterior horn, so lower motor neuron deficit is present in spinal muscular atrophy. It is also known as Werding-Hoffmann syndrome Waring-Hoffmann syndrome. Spinal muscular atrophy type 1 is also known as Waring-Hoffmann syndrome. What you have to remember in here, that as there is lower motor neuron type of deficit, the three things: floppy baby, fasciculations, floppy baby, and flaccid paralysis. Okay, now ALS. ALS means amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. In here, what you have to remember, that both upper motor neuron and lower motor neuron deficit is present in ALS, but there is no gallbladder involvement, no sensory involvement. As the lower motor is lost, so there is anterior corticospinal tract is involved. As upper motor neuron is deficit, upper motor neuron is lost, so there is lateral horn is also involved. So features of upper motor neuron. Are exaggerated jerk, spastic paralysis. On the other hand, for lower motor neuron, there is flaccid paralysis, there is fasciculation, there is muscle atrophy is present in ALS. And the great physicist called Stephen Hawking has this disease. But gallbladder is intact, sensory intact, sexual activity intact in here. Okay, now syringomyelia. In syringomyelia, it is involvement in here. Anterior horn is involved, anterior corticospinal or anterior horn is involved. Anterior horn is involved in syringomyelia. Syrinx is the 5 syrinx, and in here there is a pain and temperature is as this is involved. So anterior corticospinal tract for pain and temperature in upper extremity is lost. Pain and temperature in upper extremity is lost. This is cape-like distribution. This is also called cape-like distribution. This is also known as cape-like distribution. It is seen in Chiari 1 malformation. This is seen in Chiari 1 malformation. Syringomyelia. Sometimes lateral horn is involved. Sometimes lateral horn is involved. And it leads to Horner syndrome. Now, Cauda-Equina syndrome. What happens in Cauda-Equina syndrome? There is compression of the spinal root L2 and below. There is compression of L2 and below. There is compression of L2 and below. There is a radicular pain, absent knee or ankle reflex. Radicular pain, absent knee or ankle reflex. ankle reflex, loss of bladder and anal sphincter control, saddle anesthesia. So there is radicular pain, absent knee or ankle reflex, and loss of bladder and anal sphincter controls, and there is saddle anesthesia. So emergency surgery and steroid is the treatment of choice. Now, vitamin B12 deficiency. What happens in vitamin B12 deficiency? There is dorsal column and lateral horn is involved. For dorsal column involvement, first of all, you have to remember that vitamin B12 deficiency is a sub vitamin B12. For vitamin B12 deficiency, there is subacute combined degeneration of the spinal cord. So SCD is the mnemonic. So S means spinocerebellar tract, C is corticospinal tract, D is dorsal column. So dorsal column is involved, lateral corticospinal tract is involved, and spinocerebellar tract is involved. For spinocerebellar tract, there is loss of proprioception. For lateral corticospinal tract, there is loss of lateral corticospinal tract, and there is proprioception. Two prior discrimination is lost due to dorsal column involvement, and as there is involvement of the spinocerebellar tract, so there is ataxia, and that is the thing. For spinocerebellar, there is ataxia. For corticospinal, for dorsal column there is position, vibration, 2-point discrimination. Position, vibration, 2-point discrimination is lost for dorsal column involvement, and there are sometimes there is involvement of lateral corticospinal tract too, and that is the spinal cord lesion. Inshallah, you will be benefited from this lecture because it is highly simplified and easy to digest.